Good time of the day, dear colleagues. My name is Almaz Sharman. I'd like to present a 2-year cohort study of long-term smokers who shifted to the use of heated tobacco products, HTP. My presentation is entitled Respiratory Function, Physical Capacity, and Metabolic Syndrome Components in Combustible Cigarettes and Heated Tobacco Product Users, a 2-year follow-up cohort study. Chronic obstructive pulmonary disease, COPD, is the third leading cause of mortality with 3.2 million deaths worldwide in 2019. In Kazakhstan, COPD is the fourth leading cause of death and affects approximately 1.4 million people. COPD is a major healthcare burden as it negatively affects the quality of life and is the third leading cause of hospital readmissions within 30 days. Cigarette smoking is the most common risk factor for COPD. Almost a third of people who reside in Almaty, the principal city of Kazakhstan, are smokers. In recent years, the use of HTP products have significantly increased. Prior literature suggests that heated tobacco products might be a better option for people who cannot quit smoking. In a recent study, changes in a daily cigarette smoking, annualized disease exacerbation, lung function indices, patient-reported COPD assessment test scores, CAT scores, and 6-minute walk tests were measured in 19 COPD patients using HTP at 12, 24, and 36 months, and compared with a group of age and sex-matched COPD patients who continued using combustible cigarettes. Subjects using HTP had a substantial decrease in annualized COPD exacerbations within the group mean at baseline and 3-year follow-up. In addition, substantial and clinical significant improvements in CAT scores and 6-minute walk tests were identified at all 3 time points in the HTP cohort. However, most of the prior studies of HTP use had limited sample size and duration. As a result, the aim of this study was to analyze the long-term effects of shifting to HTP use compared to continued combustible cigarettes use in long-term smokers. Briefly, this is a cohort study which matched 1 HTP user to 2 combustible cigarette users by gender, men and women, age, education, and baseline exposure level, number of pack years. HTP users were defined as participants who switched from combustible cigarettes to HTP use and predominantly use HTP during the day, more than 70% of time. We recruited 1,200 participants, 400 HTP users and 800 combustible cigarettes users, age 40 to 59, with a minimum of 10 pack years smoking history. The participants were followed up for 24 months with functional outcomes and smoking status measured at baseline, 12 and 24-month period. Signed informed consent was obtained from all participants before enrollment to the study. The clinical functional outcomes were compared between HTP and combustible cigarette users and included continuous patient-reported CAT scores, post-bronchodilator lung function parameters, including forced expiratory flow in 1 second, FEV1, and forced vital capacity, FVC. Also, the study included exercise tolerance using 6-minute walk test and metabolic syndrome components, including waist circumference, fasting glucose, blood lipids, and blood pressure. One-way ANOVA was used to compare outcome measures at baseline, 12 and 24 months for HTP and combustible cigarette users separately. Outcomes which were significantly different between follow-up period were further investigated using linear mixed models. Linear mixed models, including repeated measures, were performed to compare the effects of smoking status on main functional outcomes. 1,200 recruited participants were followed up for 24 months, during which 16% participants dropped out from the study. The loss to follow-up was similar to in both groups, with 15% for combustible cigarettes and 18% for HTP users. After 24 months of follow-up, 107 or 9% participants quit smoking. There are no significant differences between combustible cigarettes and HTP users at baseline, except for CAT score, which was lower for HTP group. Here we use graphical representation of change in functional outcomes over time. This was further analyzed using one-way ANOVA. The analysis between baseline 12 and 24 months follow-up demonstrated that CAT score, FEV1, AVC, 6-minute walk test, weight circumference, HDL cholesterol, and systolic blood pressure were significantly different between follow-up for combustible cigarettes and HTP users. In particular, CAT score significantly decreased for both combustible cigarettes and HTP users, from 12.8 to 11.2 for combustible cigarette users and from 11.9 to 10.7 for HTP users. Otherwise, the health parameters of the participants have improved over the observed period. The 6-minute walk test results were increased from 510 to 526 for combustible cigarette users and from 510 to 532 for HTP users. Metabolic syndrome components, including waist circumference and high-density lipoprotein cholesterol, significantly improved over time, while HTP users also experienced decrease in systolic blood pressure. Repeated measures analysis show that HTP users demonstrated significantly better functional outcomes, including self-reported COPD scores, exercise tolerance, and metabolic syndrome components compared to combustible cigarette users. The analysis demonstrates that lung function decreased significantly less for participants who shifted to HTP compared to combustible cigarette users over time, despite that it was significantly worse for HTP users at the baseline. While improvements in health in this cohort can be attributed to irregular access to qualified physicians running this study, HTP users showed significantly overall better functional outcomes. These findings are supported by the existing literature with a systematic review of 15 studies demonstrating reduced health risks associated with HTP use when compared to combustible cigarette use, especially considering the potential direct effects of combustible cigarettes use on chronic diseases. This study has several strengths, including large sample size of 1,200 participants with relatively low dropout rate. However, there are also some limitations. The major limitation is that 2 years follow-up is not sufficient to study the effect of shifting to HTP use on chronic conditions. The other major limitation is that the cohort participants were recruited and followed up in healthcare centers, which led to significant improvements in health outcomes for both combustible cigarettes and HTP users. This limits generalizability of the results of this study is not, as not everyone has access to quality healthcare. Additionally, over time, decline in FEV1 and AVC observed in combustible cigarettes users falls within normal clinical variability and should be interpreted with caution. There might be some potential residual confounding that might explain associations reported in this study. However, the model were adjusted for important factors and the chance of significant residual confounding is low. The results of the study demonstrate that shifting to HTP use can potentially be less deleterious than continued combustible cigarettes for long-term smokers. Future research should concentrate on further follow-up of this cohort to identify effects of shifting to HTP on existing and emerging chronic conditions, as well as health-related measures and outcomes. While this study has shown shifting to HTP use to be less deleterious compared to combustible cigarette use, the results of the study should be interpreted with caution, and quitting smoking is more advisable than continuous use of combustible cigarettes or HTP. Thank you.